Hello Year 12, welcome to another video for maintaining a balance. Today we are looking at 9.2.2.S3, analyse information from secondary sources to identify current technologies that allow measurement of oxygen saturation and carbon dioxide concentrations in blood, and describe and explain the conditions under which these technologies are used. So, unpacking this dot point, we've got a couple of verbs that we've got to look for today. The first one, analyse, is actually just looking at your ability to extract information from different sources. So that could be a video, a textbook, or a teacher. What your goal is to actually just identify the names of a couple of technologies that are used for measuring blood gases, the oxygen saturation and carbon dioxide concentrations. And then we are looking for the features of conditions where you would then choose one of those technologies over another in that particular time and place. Like what is it that these two technologies have that would make them desirable over the other? Alright, let's get stuck into it. So this is a dot point from the second column. It's about skill building. And so I just wanted to kind of show you this little pyramid here. We start with data from a piece of equipment. A doctor will take meaning from that. With the knowledge that they've got, they can put that information in the right context, and then they can make the right decision, which we essentially call wisdom. So our goal is to get you guys to not only know your stuff, but then apply the right stuff at the right time, which is what this is all about. A bit of high order thinking in this one. Okay, so our first technology is pulse oximetry, and I think this is one that's you might not have known what it is, but I think you would have seen it. It's a little probe that looks like a peg that shoots red light through a finger. That's the simplest definition I can give of it to you. What it does, though, it's using infrared light and red light to pass through your finger, and then what's left is read by a photodetector on the other side. Basically, hemoglobin, when it's attached to oxygen, is bright red. And when it's not, it's a dull reddy maroon. And so using the properties of hemoglobin and when it's attached to oxygen and when it's not, a nurse or a doctor is able to look at this machine, read the numbers, and kind of go, okay, yes, there is an appropriate amount of oxygen in this person's attached to this person's hemoglobin, which means they're getting sufficient oxygen for their cells. Okay, so that's the technology. When should it be used? Well, it's a pretty cool technology. It's like just a peg that sits on the finger. So in that case, it's non-invasive, and that's a pretty important feature to have of a technology. We generally always like non-invasive procedures over invasive ones. It also gives continuous live measurements. Now, these measurements aren't perfect. Because what it's measuring is hemoglobin that is attached to oxygen, but sometimes hemoglobin can be attached to carbon dioxide, which we know is carbamine hemoglobin, and that can give a bit of a false reading. But this false reading is relatively well understood by nurses and doctors, and so they factor that into their reading of the data that comes off this machine. We use it because when we use it is because someone might be undergoing surgery and you need to kind of make sure that nothing critically is going wrong, or they're being sedated and you want to make sure that when you are putting them under sedation that you aren't causing them to go into some sort of like coma or anything. A patient may present if they have abnormal breathing or circulation, and so it's just a kind of a quick check for them. And you might also use this in case you've been given a new medication in a bit of a critical incident, and you just want to make sure that your blood gas levels aren't getting too affected by this medication. The other thing it can be used for, and you might have seen this on people, is when they are undergoing stress testing. So you might use it in the military, or like Olympic athletes or professional athletes might be using it, or emergency services. Basically, you put them under stress conditions, and then they you're getting a readout of what's going on with their blood, whether or not adrenaline's kicking in and enough oxygen is being circulated around the body, that type of stuff. Alright, so we have our second technology, and this is arterial blood gas analysis, also known as ABG. Alright, so this is, as you can see from the picture, this is where blood is extracted from the body using a needle and syringe. So in that case, it is invasive, which brings about a whole bunch of trouble, if, easily mitigated trouble, but a bit of trouble. As soon as you start piercing skin, you start after thinking about infectious diseases, you have to start thinking about secondary infections, you've got to think about pain, and you're also not getting live information. You actually have to take this blood in that sample away to another machine and put it through the machine, and it does some some processing, and you get some results back. Now, that might sound like, well, that's a terrible thing, but actually what it gives you back is a far better analysis of the blood gas composition, because it measures very precisely 4 very specific things, and they are blood pH, oxygen saturation, carbon dioxide concentration, and then the pressure of both those 2 gases. That's a very useful tool for anyone who wants to know some really good details about your blood gas composition. So, which means the first reason you would use it is as a diagnostic tool. If you're a doctor and someone's and you think that they may have kidney disease or diabetes or heart failure or chemical poisoning, then you would do ABG just to make sure that your diagnosis is supported by some evidence. A patient may also present with shortness of breath, difficulty breathing, confusion or nausea. Now, none of those are like life-threatening. It's not a crisis situation. You may just go, oh, doc, God, really short of breath here at the moment. It's not. It's not life-threatening. It might be annoying. You might feel terrible, but that a doctor might go, what, we've got some time to work through this problem, and so we want to know very precisely what's going on inside of you. You might also have a family history of lung disease, kidney disease, or metabolic disease, and so just as a as in your health checkup, you might get a blood test, and you might actually have some markers for some of this stuff. So just using it again, that's similar to a diagnostic tool, but this one's more just like an exploratory health checkup. You can actually just have that done. And the other one is that you might have started on a new medication for any of the above points, like diabetes, heart failure, chemical poisoning, or kidney disease, or lung cancer. If you are on a new medication, the doctors want to know whether or not it's going to be successful, and they need something to measure that from. So if there's a variable like oxygen saturation that they want to improve, well, then you want to make sure that you're getting precise measurements of that in order to make that happen. Alright, so that's the content for this video. What you should be doing is setting out your response or notes. I should have put the word notes up there, but anyway, your response or notes to this. So you want to have a bit of a table. There should be a question mark there, but anyway, what does it measure? Is it invasive? When should it be used? And why should it be used? So once you've got this table down, and you're starting to process this information a little bit more, we're going to present you guys with a series of patient case studies. And what those case studies are going to be is that you're going to get a bunch of raw data from them. It might be, patient is 27-year-old male, presents at a hospital at King's Cross with a laceration to the head after a pub fight or something like that. And basically you're going to need to make some decisions about which technology you would use, and that's about understanding when and why you should use one of these or both of these technologies. Alright, that's it for the video. Thanks for listening.